Okay, this is Dr. Rachel, and I'm Dr. Victoria. I just wanted to make sure that we are actually in the video. We are at Iron Horse PT and Pilates in San Ramon, and I'm the owner. I've been a PT, orthopedic and pelvic floor PT for 25 years. It's a long time, and I've had the practice for about 15. And we do a little bit of sports orthopedics, and we also have a specialty in pelvic floor, and I have a specialty in treating runners, triathletes, and people who want to lift and work out at a higher level of function. And then this is Dr. Rachel. Yeah.
Hi. Let's see. I've been a physical therapist also for 25 years. I've been doing pelvic floor PT since 2007 or so. Started working with Victoria recently.
Yes, we're lucky to have her. She actually works with men and women.
Yes.
Men have pelvic floors too. So we wanted to come and maybe just do like an open Q&A. There are a couple things we do want to just kind of educate women on, just sort of the myths and things about pregnancy and pelvic floor. And one of the things I think that we see that's really common is some of our patients come in and they're like, oh, my doctor just said I have to live with this until I give birth. You know, like they have sciatica, or they have pubic pain, they have pelvic pain, hip pain. You know, there's lots of aches and pains associated with pregnancy. And you don't have to deal with it. There's often things that we can do in orthopedic and pelvic floor PT that can give women immediate relief. You know, I've had women waddle in, and I'm sure you've had this too, and they're like at pain with every step. And we do a few things, and they walk out like a normal person. They're like, oh my God, I'm so glad we found you. You know, like my doctor told me it was just round ligament pain, and I just had to suck it up. And I'm like, no, that's not true. You know, you don't have to have pain with intercourse. You don't have to be peeing on yourself. You don't have to be in pain all the time and just suck it up. Okay, so that's like probably the number one myth I would say. That's really, I just want to educate women on because it's not true, right? And then the second thing would probably be like, oh, just do Kegels. So maybe you could talk a little bit about why doing just Kegels is like not the answer.
Yeah. So a lot of times we see a lot of tight pelvic floors. In terms of just doing Kegels, it can make the pelvic floor a lot tighter. Also just decreases the ability for it to coordinate with that relaxation, the contraction as needed. So lots of different things need like a contraction, lots of different things need a relaxation. And when you're pregnant, you need to practice opening your pelvic floor, releasing your pelvic floor. I teach a lot of breathing, we do a lot of breathing and pelvic openers, especially directly related to the pelvic floor itself. So typically just doing the pelvic floor contractions isn't always the best answer. It's more complicated than that. Typically when I see somebody or Victoria, we do an evaluation and we look at your situation, right? So it's very individual.
Yeah, another sort of myth to piggyback off that is people think if they have a really strong pelvic floor, it's going to help them deliver the baby. Like somehow you'll push the baby out better or faster if you have a really strong pelvic floor, and that's definitely not necessarily the case. And sometimes if you've got really a tight pelvic floor and overactive, like you always have tension there, it's actually hard to deliver because it's hard to let go and spread for the baby to exit. Because your pelvic floor muscles don't actually push the baby out, the uterine contractions do it. So your pelvic floor muscles have to get out of the way and kind of melt. So that's another big one. I feel like that's a huge myth.
That's a big one, especially if you have a history of that pubic bone pain or back pain or having hip pain. Your pelvic floor is likely running on the tighter side just because that's what it does, right? It's a very close neighbor and it will respond accordingly.
And yeah, and working with a lot of very fit women, including Pilates teachers and like the group exercise instructors, like the bar and the HIIT classes, many of those instructors actually have hypertonic or high active pelvic floor, and they often leak and pee on themselves because of that tightness and extra activity. And these are the ones who are teaching you about, right, pelvic floor health, and yet sometimes they're the ones with that dysfunction, because a lot of times in fitness it's all about activate, and they also need to the floor for some Q&A. What burning questions do you have? Yes, what's your name?
Angela.
Angela, go ahead.
Okay, so a couple questions that go together. You mentioned knowing the difference between like pelvic floor issues and pain versus round ligament. So like what would be the difference between the two, like differentiating that? And then how do you know if you have like a tight pelvic floor, a loose pelvic floor, having pelvic floor issues? Like I don't know what my pelvic floor is doing right now. I had a C-section, the first baby. I don't think I have any issues, but what would be some like red flags or indicators that maybe I do have some pelvic floor stuff going on?
Sure, there's a couple questions in
Yeah,
there.
there's
Maybe let's
five.
unpack the first one. What are some things you want, like for round
So-
ligament pain?
I mean, round ligament pain, the round ligament it's from the uterus, it goes into the labia. So sometimes it can mimic some of the things with pelvic floor dysfunction. It can contribute to some of the pelvic floor overactivity, but it's just in a different spot. So pelvic floor, like a tight or overactive pelvic floor will be things like leaking could actually be one with a tight pelvic floor or a more relaxed pelvic floor. Also pain with intercourse, trouble with bowel movements. It's not always pain with bowel movements, but if you have a lot of constipation, which goes with pregnancy, sometimes you can't open the pelvic floor, right, for evacuation. So kind of those are, and then sometimes if you just have that pubic pain or any sort of SI joint pain or pain in that pelvis, a lot of times it's overactive.
Okay.
Or at least not firing well.
Tight hips is another one.
Yeah.
I find like a lot of women who complain that they have tight hips, they can't get down in their squat, they get pinching in the front of their hips. It's often is a sign
Yeah.
that or detension.
Deep butt pain
Yeah.
is another one.
But that's, so round ligament is kind of like that location is kind of,
On the side.
Or pubic bone pain, pubic
Yeah.
symphysis pain. Yeah, that's more like in the center. It can be a little bit off to one side,
Or
but like,
sometimes you'll feel it in the inner thighs, like when you're walking, you'll feel pain in the inner thigh.
yeah, because if you look at the pelvis, it's actually two bones. You have two, they're called innominate bones, right? And you see that little piece of cartilage in the middle? That's your pubic symphysis, and it's supposed to open. Like when you've got relaxin, the hormones circulating your body, it kind of lets those ligaments relax so that this can help open the birth canal.
Right.
But if you don't have muscle balance around all the muscles, then this can move a bit more than you want, and it can start to give you some pain. Turning in bed, getting in and out of the car, things that you open your legs, like lunges, might be painful. You might want to avoid that if you're getting. So like if you have pain with movement, it's likely not going to be as much round ligament pain. Like it's more mechanical.
Okay.
Yeah.
Got it.
Stairs, anything where
Yes.
Yeah.
Yes, exactly. So that's how you kind of can differentiate between just regular round ligament pain stretching
Yeah.
versus like a mechanical movement-based problem.
Right.
And then I think we talked about the tension. The other thing I will say is if you've got a lot of neck and jaw tension, people who clench and grind their teeth at night often will clench down here too. Not always, but there is a correlation. So if you do that, you might have tension. But the best way to know is honestly to get evaluated by someone like me or Dr. Rachel, right?
Yeah, typically, I don't know if any of you know what we do, but typically an evaluation can include external palpation, right? But also internal palpation, as long as you're cleared by your OB-GYN. As long as you can have sex, you can have an internal exam.
Yeah, it's not the same as a gyne appointment. Like there's no speculum.
No.
We insert one gloved finger, and this is actually a good demonstration, right? So this is your clitoris. This is where you pee out of. This is where you poop out of. And you actually have 3 layers in the pelvic floor, and we just take one gloved finger, and we will kind of do a clock and sweep around the 3 different layers. And we'll check both sides, we'll check the muscle strength, how good is your contraction? Is it uniform? Can you squeeze around our finger and slightly pull up? How long can you hold the contraction for? And if you can do 10 quick ones, those are often things we'll look at. We'll also look for things like prolapse, which is like when the organs start to descend towards the vaginal wall. Kind of like boobs, boobs can sag. Like some of our organs can sag, especially with that relaxing, and if you push the baby out for a long period of time, sometimes that can start to push some of the tissues down towards the vaginal opening. And sometimes women don't know until they're like showering one day and they're like, what is that? They feel a bulge. Anyway, not to freak you out.
Yeah.
That's just,
No.
I'm just,
given.
it's not a given. It doesn't have to happen. I'm just giving you an idea of what to look for
Yeah.
and what it entails.
We also look at the relaxation of the pelvic floor muscles. So we have people breathe. We have you breathe, and can you open, right? Relax the pelvic floor. And what kind of excursions you have? What kind of length do you have in that pelvic floor? And is it lengthening when it needs to?
Can you demonstrate like one or two movements we can do at home to help with? I know it like doesn't, or it may not help the like intensity of labor, but is there anything that we can do at home to just help open up more? Like, is there any movements you suggest that we can try? I had like my epidural like wore off. It didn't like really work. I've heard with like redheads, it's like there's a connection with like pain. It's like not a
you need more.
vision study.
Yeah.
So like I felt everything.
Yeah.
Everything. And I was like, I thought that, and so then I was like, is this normal? I don't think it was. But then it made me feel like, oh, I should have done more. I don't know, I felt so much pressure of the like pushing, and then I didn't know if that was just because like the epidural didn't work, or if it was like, should I have done more to prepare? Because I really didn't prepare much with like my body. So this time around, I just want to like prepare as much as I can without, I know there's a pain still, but I just didn't know if there's anything that we could do at home, like a simple exercise to help with those muscles right there.
You mean to relax them?
To relax.
Yeah. Well, what's your name?
Holly.
Holly. You want to take this one?
Yeah, sure.
Yeah.
I mean, there are quite a few you probably are doing, but just adding breathing to it. So,
Okay.
like one would be happy baby. So you can do it in different positions, right? Also, just lying on your side, because once you get to the point where you can't really lie on your back, lie on your side, right? So you can just lie on your side and practice breathing. Sometimes going like this,
Okay.
right? Sometimes just like this, with a
Okay.
pillow between your knees. The big thing is you want to breathe from your diaphragm.
Yeah.
Okay, so you want to breathe so that your rib cage opens all the way around. It's not just in the belly. But
Okay.
it's kind of like when you start talking about belly breathing, it's kind of like that, but we're looking at a 360. Because when you breathe in, so inhale, you feel pressure downward into the pelvic floor, right? So that inhale, the diaphragm moves down, the pelvic floor is going to move down and open. So that inhale, you want your side, that lateral rib cage to move out, the back rib cage to move out on that inhale, right? And keep it out of your shoulders.
Yeah. So the ribs attached to the thoracic spine back here.
It can be
And so
very
it's-
stiff.
Yeah, so you could do this with a partner or your friend and take a nice deep inhale, as big of a breath as you can, and push into my hands here with the breath.
And sitting in this position is a good position to practice that if you're sitting up. And then you can also do, cat-cow, right? So inhale, exhale like that. As well as just child's pose, right? So it kind of depends where you have your tightness. Child's pose is really nice for opening up in this back part of the pelvis, right? So, you could do a supported child's pose all the way down. Yeah, and breathing. So the big thing here would be kind of that breathing. A lot of times if you have you're really tight, because you have maybe a history of tight hips, low back pains, a lot of times in PT we're working on the SI joint, and try to get them to open as well. Because a lot of times people are really tight. And the glutes.
Just kind of add on to that, can you talk about like the difference between Kegels and then doing this like more breathing where you're loosening and then tightening
Yeah.
together?
So when you inhale, right? So you inhale, the pelvic floor moves down, right? So inhale into your rib cage, that's an opening. Keep your shoulders down. Exhale is when you would theoretically pull up and in with your pelvic floor, because the pelvic floor is moving up with that exhale. Okay? So you kind of want to think about coordinating, like if you're having leaking, even if it's a tight pelvic floor or something, just working on an exhale with any effort. So usually I say, E with E, like exhale with effort. You're going to lift something, you're going to do something, you want to contract, exhale. But the caveat to this is you wanna make sure that you're taking maybe 3 to 4 or 5 even inhale breaths before you do another contraction, just to make sure you're not getting too tight. Because a lot of people just do their pelvic floor contractions, hold, right? And you wanna make sure that you're getting that relaxation in between.
That's like the more important part is the.
Yeah, I don't know about you, but we see a lot of actually on the tighter side, right? When you're pregnant, your body is trying to hold. It's the bottom of your canister, right? The bottom of your core. So it's going to try to compensate and hold. You're losing kind of that abdominal wall control, right? So your pelvic floor is going to try to compensate your hips, your back muscles, and then sometimes you'll even hold your breath when you don't want to. Like you need to practice exhaling and doing what we call decreasing pressure in the canister. So you want to make sure you're kind of working on that as well. So it's I don't know, it sounds more complicated than it really is. We kind of think about exhaling with effort.
Yeah. So instead of just doing Kegels where you're contracting, you're focusing on both the contraction and the relaxation.
Yes,
together.
correct.
And that's
Yeah.
something you can also just do throughout pregnancy to
Yeah.
prepare.
Mm-hmm.
Does that help the reason, or is it just substitute?
Pardon?
The breathing exercise, does it help the reason the pelvic floor?
It can. If you have a really, really overactive pelvic floor, sometimes you need manual soft tissue work. Like if you feel like it's just not enough, and the breath isn't enough to open and lengthen those muscles. Sometimes with those people, we have you doing massage of the pelvic floor.
Yeah, so going back to your question, Holly, you asked about exercises that could help relax things. So these are in sort of your body's brain-body connection to relax, but then you could also take a little massage ball and put it against the wall and roll it against the wall to open up some of the musculature back here, even in the front, along the sides, so the glute, and then the glutes, right? So that's those are, self-myofascial release type of exercises that you can do to help loosen pelvic floor. So just like we can get knots and tension in our necks and stuff like that, and you can use massage balls for that, there are therapeutic tools that you can use internally in the form of a pelvic wand or a dilator that can help loosen manually.
Right.
If the breathing is not enough for your system to let go, right? You can kind of meditate and relax and some muscles will let go, just thinking externally and using that analogy. But sometimes you kind of need someone to get in there with their hands and help you loosen up a knot or something like that with some manual pressure. So,
Is the tapeworm related to the?
Yes.
Everything.
It
Absolutely.
attaches directly in
Because I sometimes get tapeworm pain more recently, after my baby started expecting, was not there before.
So that's another signal of an overactive, a tight pelvic floor.
or lumbar spine dysfunction.
Yeah, or lumbar spine.
That can be referred from your spine also.
That is true.
Posture and L5S1 can be an
And
irritation.
also I stayed for a longer time,
Okay.
Yeah,
So it could be.
still in the same room for the whole class or something like that, depending on the day. That's the day I feel one day one is
Yeah.
getting stressed out a lot. And it started happening more recently, after my girl started expanding, it was not.
Yeah, as you get bigger, you might start to have more of that lordosis, that
Oh, yeah, I
curve.
do this a lot.
Yeah, and so that could put some more pressure on that lower lumbar segments, L5 and S1, and that can refer to your tailbone or coccyx, and or just the pressure and your posture when you're sitting can also give you some tailbone pain, or also known as coccydynia. So there's some differential diagnosing you have to do. 'Cause
right.
It could be the pelvic
It's
floor
hard to know.
musculature.
Could be a
That's
lumbar spine. Yeah, usually when you come in, we're looking at not just the pelvic floor, we're looking at the whole system, just top down.
You probably have one for one more quick question and then wrap it up.
Okay,
for the
sure.
last one.
Okay, who's got another question?
It's a bit embarrassing, but about leaking, especially when you sneeze, I feel like I'm trying to not tighten too much. So I think the body, that's when it's happened to me. Is there anything that I can do to prevent that, or should I just be okay with tightening up? I don't know. I just my body overcompensates because it tries not to
Well, first of all, you don't need to be embarrassed. It's really common. It's not necessarily normal, but it's very common in pregnancy because you've got that increased intra-abdominal pressure. The pressure has to go somewhere, and then your pelvic floor has to be able to counteract that pressure. So it's quite common for there to be leaking. So don't feel embarrassed by it. It's literally just a pressure issue. It's a pressure, you're sneezing, it's quick, and then the pelvic floor has to be reactive and strong enough to counteract that pressure, right? So actually we do teach women to Kegel right before they sneeze. Sometimes the timing is off, and you just do the best that you can, right? Sometimes you teach people like different positions to sneeze.
Yeah. Sometimes,
I know, there's like a way to sneeze.
Yeah, so you're trying to get this front part of the pelvic floor to contract fast. So sometimes there's a lean forward, getting your knees together. It's hard to do in standing because that pelvic floor contraction against pressure is harder to do in standing than sitting. So you'll notice you probably leak more when you're standing or or walking around or something like that. But it's hard. But if you're leaking, while pregnant and you continue to leak postpartum, there's a little bit, right? A few weeks. But if it continues on, that's when you should think about contacting a pelvic PT, because that means you probably need to work on some strengthening. And it's coordination for the whole core, right? Like everything did a lot of work.
Thank you so much. This was really helpful.
Oh, you're welcome. Pleasure. Thank you guys for having us. If we could get a picture, that would be great.
I was just gonna say that. Maybe you want to use your phone and
Sure.
have